everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, a range of supplements designed for people diagnosed with chronic kidney disease. Whether you've got a low eGFR or high creatinine, we might have a supplement for you. And I'm joined again today by the fabulous, the wonderful, the ever so lovely Jessianna Saville. Jessianna is a renal dietitian. She heads up Kidney Nutritional Institute across there in the US. She has been a renal dietitian for a long time, and what I love about Jessianna is, apart from being curious, which Lindsay, also from Kay and I, talk about, she thinks outside the box when it comes to things of kidney disease. We have bonded over our love-hate relationship for potassium, low potassium diets in chronic kidney disease, which is now actually the latest KOGI guidelines came out and said there is no reason that you would do that unless it's in a blood test. So we are working our way through amino acids and the role that they play in chronic kidney disease, and we are at one of the major amino acids that may be useful in kidney disease, and that is, as us Australians call it, taurine. You pronounce it a bit differently, Jessianna.
Yeah, I'm not sure if it's just because I'm American or if I'm from the West in America, but I would call it taurine, which always sounds much better because American English always sounds a little bit harsh, and everywhere else sounds nice.
Somewhere in there, from taurine to taurine, we are talking about the amino acid taurine. So Jessianna, thank you for joining me again today and sharing your brilliance with us. I'm going to hand over to you to start our discussion about this amazing amino acid.
Okay, awesome. So if you're joining us for the first time about our amino acid conversation, we've done multiple of these. And one of the reasons that we decided to dive into them is that protein is such a hot topic in the kidney world. And there's quite a range of opinions, from using very, very, very low protein diets to moderate protein to plant-based diets, and like all sorts of things in between. Sometimes you'll see people talking about carnivore diets, but protein always seems to be a hot topic. So when we were looking at this topic of amino acids and just thinking about protein in general, I was like, I don't think the answer is actually protein. I do think amount and type of protein matters for kidney disease. The research is good, but if we really wanted to dial it in and understand what's happening when we decrease protein or increase protein, I think what we really need to understand are the amino acids. So that's kind of the premise of this discussion. So taurine is what is called a non-essential amino acid. So essential amino acids are ones that we have to eat. We won't be able to have them in our body. They're essential, right? Non-essential means our body can synthesize them from other amino acids that we might consume. So taurine is a sulfur-containing amino acid. It's not built into proteins. It's a little bit different because it's not part of like a protein building block. It's more a cell regulator. So already it's very, very different from so many other amino acids that we would talk about. One thing that's really interesting about taurine, which is why I really think we need to pay attention to it with the kidneys, is that the kidneys actually have the most taurine in the tissues of any other organ. It's also high in the heart and the brain, but the kidneys are, I can't remember what the number was. It was like 5 times more than like the other, I think, I can't remember if it was the liver or the heart. Now I'm forgetting. But like the next organ with the highest amount, the kidneys have like 5 times as much. So they're very, very rich in taurine, which makes us think, why would our body need so much taurine in the kidneys? And if we're deficient in it, is that going to impact our kidney function? So that's one of the things that's really important about taurine to know, and interesting when it comes to the kidneys. As far as its jobs, so taurine has a couple jobs, and we're going to talk about these, and we talk about where you see taurine show up in the research with the kidney disease. So a couple of things here. So one core job is as an osmolyte. So we'll talk about osmolytes and PKD in a second, but this essentially is cell volume control. It deals with calcium handling, membrane stabilization, bile acid conjugation, and one of the big ones, why it's so interesting, is this antioxidant, anti-inflammatory signaling pathway as well. Did I miss any of the jobs there, Fiona, or any ones you want to add on to it?
Um, what did you say?
Osmotic.
Osmotic regulation, antioxidant, glucose
Yeah.
homeostasis, and anti-inflammatory.
Oh,
They're the big
there,
four.
I didn't do glucose homeostasis, so that was good. Yep, perfect. So anyway, so that's kind of intro to taurine, like kind of a few basics there.
Perfect. So when people are thinking about taurine and using it in kidney disease, because it is so abundant in kidney tissue, what sort of situations would you think about using it in kidney disease? Is it blanket for any type of kidney disease? I know you mentioned PKD in there, or is it very specifically driven? We also mentioned about its glucose homeostasis. So is it and we know that, and blood pressure. So we know blood pressure and diabetes are the big drivers of CKD. So we're thinking about it in those ones in particular. So yeah, talk me to when we would think about using it.
Okay, so I think there's more usages for it than's in the literature, but I'll talk about where we're seeing it studied right now. So first one that I want to talk about is diabetic kidney disease. We do see a good, and probably most of the robust kidney data on taurine is in diabetic nephropathy. So what you see with diabetic nephropathy, so what that is when your diabetes is out of control, you have really high blood sugar levels, and it basically kills parts of the kidney. That's diabetic nephropathy. So what we see is that taurine in the studies in diabetic nephropathy, that it helps decrease oxidative stress. Now, oxidative stress in the kidneys is massively a huge issue. Especially the more you progress, it kind of compounds. And so addressing it or kind of like breaking the cycle in oxidative stress can be a huge therapeutic tool. It helps with fibrosis. Also, fibrosis is kind of this scarring or like hardening of the tissue. You'll see it improve your glycemia and your lipids. So the blood sugars improve the lipids, so cholesterol, HDL, LDL, and I know you'll talk about in a second. That also improves as well. You'll see protein in the urine decrease as well. And some of the studies in particular, they're actually looking at metformin and taurine comboed together because they tend to have kind of a synergistic effect of enhancing insulin sensitivity and reducing the fibrosis. So those are a couple places we're seeing in the literature that taurine for diabetic kidney disease is being very impactful.
Yeah, I think that's a big player, as we know, and we know, like you say, just how much it has that effect on, what's the technical word that I used before, on glucose homeostasis, and it does that with it interferes with the insulin signaling pathway and it acts upon UCP2 protein. That's the specific mechanism of it. So yeah, people we know have lower plasma levels of, that was the other thing, and I missed if you said this, Jess, but the people with diabetes are seen to have lower plasma levels of taurine in the body when compared to healthy controls.
No, I didn't mention that, but that's good to know.
Yeah, and so the role of taurine against the production of advanced blood sugar dysfunction was due to high reactivity with aldehyde when compared to various other amino acids. And so in some studies, taurine supplementation put a stop to the process that precedes the late onset or the late stages of diabetes and actually can prevent it from manifesting altogether, is what I'd seen in the literature, which was very, very cool.
Wow. Yeah. I mean, again, like if you look at taurine, so often we think of protein, amino acids, like building blocks of muscle. But whenever I come back to it in these studies, I just see that it's this amazing cell regulator. It's like I don't know what is the right analogy of it. It's like the policeman of the cells, or like, I don't know, the supply wagon of the cell or something.
Well, it
I
makes
don't
sense
know.
because there's similarity, right? And how it's going to have something to do with that whole electron transport and ion exchange if it's doing that. So I don't know the nuances of how it does it, but that totally makes sense for you to say that. So yeah.
Yeah, it is such a cool thing. Okay, so that's diabetic kidney disease. Do you know for diabetic kidney disease the general dosage that people are using? And as a like disclaimer, we'll talk about dosages because I think it's good to know what people are using in the science, but please don't just start taking a supplement without
No.
looking at it with a doctor or a medical professional. But I am curious kind of what they're looking at for diabetic kidney
Well,
disease.
yeah, so diabetic kidney disease, some of the studies were dosing right up to 6 grams, but they were only doing that over a very short week period of about 4 weeks. And in fact, some of the cardiovascular studies were showing the same. Generally, as nutritionists and naturopathic medicine, we dose between 500 milligrams to 2,000 milligrams, show efficacy. The toxicity range was like at 60 grams or somewhere around there. It was very high. So you've got a big gap between what we would see as therapeutic until toxicity will occur. So generally high doses are very well tolerated, but back to your point, don't go taking big doses, and we'll explain why when we come to talk about
It's
PKD.
about hypertension. Yeah, that was our next one.
Yes, but I would say generally if you had PKD and active diabetes and you wanted to prevent that whole late stage diabetes coming on and or cardiovascular disease, I reckon the dose is about the same. 3 grams is going to be okay, depending on a few other bits and pieces that we'll talk about. But yeah, that would be where I would sort of put it. But I always start low, go slow, see how you tolerate things is always good too, especially if you're on medications.
Yes, I totally agree, because there's a whole other level there that sometimes it's not well studied. Okay, so let's talk about high blood pressure. Is that okay? Another component? All right. So chronic kidney disease and hypertension, as we know, is kind of this bi-directional issue. You get more hypertension, causes more CKD, but you get more CKD, you get more hypertension, right? So it's like always kind of driving itself. So taurine is interesting because it impacts multiple pathways that play into blood pressure. Blood pressure, we really should do a podcast on blood pressure, do one with Lindsay, because we just did a deep dive on this. Blood pressure has so many different pathways on which it's working. It's not just like, oh, you eat a bunch of salt, your blood pressure goes up. Blood pressure has all these different things, and there's different people whose blood pressure is high for different reasons. So what's interesting on taurine is it impacts a couple really key pathways. So one pathway is nitric oxide, the nitric oxide pathway. If you have really reduced levels of nitric oxide, you're going to have higher blood pressure. So when you increase nitric oxide bioavailability, then, which is what taurine does, it should lower your blood pressure. Another pathway that it impacts is your renin-angiotensin system. That also, it kind of dampens that overall. So this can get really elevated when you have CKD, and then that's going to drive blood pressure as well, because the renin-angiotensin system is expand your blood vessels, and that's what creates this blood pressure. So you actually want to reduce it so the blood vessels can relax and not be always in this way of expanding. And I think you were telling me earlier a little bit more about the sympathetic tone that goes with this RAAS.
Yeah, so taurine supports healthy blood pressure because it can downregulate the renal sympathetic nervous system. So it downregulates that via the production of 2 stress hormones, epinephrine and norepinephrine. So this is important because norepinephrine is known to cause vasoconstriction, so the constricting of veins and vascular tissue, which is the mechanism that we see in raising blood pressure. And then when that becomes chronic, that can lead to hypertension or high blood pressure. So taurine has the ability to work via the kidneys as an efficient hypertensive, so it relaxes the vein via that mechanism by working with epinephrine, norepinephrine. And then, like you say, the renin-angiotensin system, it also does that through calming and modulating calcium homeostasis, which is interesting because you talked about sodium in the proximal tubules, right? And so it also works as opening the potassium channels to potentiate vasorelaxin action. As well, and also that modulating calcium homeostasis. So that whole thing that you were talking about, the truck and all those kind of things, I find it fascinating, that whole osmo regularity that taurine does. It really has an effect on potassium, calcium, and sodium and the ion channels there. So that's also how it does it.
Yeah, absolutely. So and one thing about hypertension, and this is where we want to talk about the flip side of it, like all amino acids. So you're hearing this, you're like, oh man, I gotta take some taurine because it's gonna help my blood pressure decrease, and I really want to do that. So you go to the store, like I'm gonna find some taurine, and there you see a Red Bull on the shelf. And it's
Oh, no,
like
yes.
taurine, and you're like, yes, I like Red Bull anyway, so I'm gonna drink that. Here's kind of the flip side of taurine, so don't do that. Don't take an energy drink. When you look at energy drinks, which are often they're often supplemented or enriched with taurine as an energy component. Actually, though, when you get the combination of caffeine, sugar, taurine, and other stimulants they put in those energy drinks, it will raise your systolic blood pressure, at least acutely. But if you're constantly doing that to keep yourself awake or whatever, it would raise your blood pressure. So even though taurine can be helpful to lower blood pressure in some of the studies, you do not want to take it with other stimulants like caffeine. You don't want to take it. I mean, energy drinks have a lot of stuff in them that I would never, ever, ever recommend for someone with kidney disease. But definitely don't run out and grab your favorite energy drink because it's high in taurine. You really need to have a specific amino acid or amino acid blend if you're going to supplement with it.
Yes, thank you for saying that, because that is very, very important.
Okay, so we have blood pressure and we have
Diabetes.
diabetes. Okay, let's talk about PKD because this one was really, really fun to look into. So as you may know or not know if you're watching this, our organization has a particular interest in polycystic kidney disease. We were one of the first people to launch using ketogenic, low carb, low oxalate diets for PKD. So when we were looking at this amino acid, I always go cross-check the amino acids with polycystic kidney disease because polycystic kidney disease is so different. Like it works so different than other kidney diseases in a lot of ways. Interestingly enough, there was just a paper that came out 2025. I think it was August.
August, you said, yeah. So it's like hot off the
August. This is like super, super new. And what the paper was titled, I'm just pulling it over here, Electrolyte and Metabolite Composition of Cystic Fluid from a rat model of ADPKD. So basically what they did, and this was in the Communications Biology Journal. So what they did is they looked at the amino acid composition within the cysts, and they found that taurine was, of all the amino acids, the one that's most abundant. Now, given that we know one of taurine's roles is as an osmolyte, so it's holding like cell volume, that would make a lot of sense. As far as what that means on a like application, it's a little bit tricky because on one side you want to say, okay, well, you want to be taurine deficient then if you have PKD because then it's not going to hold the cysts in like a fluid-filled volume. That would be incorrect way to think because taurine is needed in a bunch of other places to stay healthy. What I think I think some of this is now we know taurine's rich in the cells. So like what's the next step in the research? But I think another takeaway is that if you have actions in your life, I think you gave the example of like a high oxalate diet that are expanding cysts, and then you add taurine on top of that, I think you're going to really get more of a, I don't know, what would you say, like a stability of the cysts expanding.
Yeah.
I'm kind of curious because we kind of pitched ideas around on this. All I know is it's the most abundant amino acid.
Yeah. And I mean, I'm very logical. We know one of the actions if PKD is driven by high oxalates is the oxalates cause damage inside the microvascular. And what happens is the vascular system expands around the crystal to try and expel it. And what happens is it stays in a hypervasodilated state, which causes actually microtrauma inside the cellular damage, which then you get cyst fluid filling up around the microcrystals and causing cysts. So my thought is if you take a whole pile of taurine, for that vasodilation effect, and you potentially then increase vasodilation, which is a side effect of oxalate crystals inside the tissue, that you may then increase the speed at which, and especially if they're finding, and it makes sense because why you would find taurine in that tissue, you potentially may accelerate the expansion, and therefore the cyst might grow a bit faster, which is what makes logical sense to me. But that hasn't been studied. We don't know. I'm postulating of just what would make sense. But and you mentioned a good point. It's all on a bell curve, right? So there's probably a part where taurine is still very useful for the diabetic part. We know the blood sugar, and that's why you use ketogenic diets. It's probably going to be very useful for glucose metabolism and those sort of things. But if you take way too much of it, it may then sit in excess inside around, micro lesions from oxalates, and then cause more fluids in there. But if you have your oxalates under control, and you're on a super low oxalate diet, and oxalates aren't a driver for you, and you've done an organic acid test, maybe it's fine. So it's just something to be aware of, I think, if you've got PKD, that maybe those big doses up to 3 to 6 grams might not be the thing for you. You might go on the lower end of it and, work that way, and be, vigilant on making sure that you're not doing excessive oxalates in your diet, maybe.
Yep, I think that would be, all of that. I 100% agree with. It's cool that it kind of works in these different pathways. I'm kind of curious your perspective, Fiona, on how you would decide if you want someone to take taurine or not. Because I know you use it quite a bit in the anti-aging world, right? And your work.
Yeah, we use a lot of it, and it's actually in our alkalizing formulas, because it has such an abundance and such an amazing role in general against kidneys. I mean, it protects against AKI as well, and we'll talk about it, but it also has a role in non-alcoholic fatty liver disease, which is generally quite high in there. Look, I always look, probably like you, I look for symptoms of taurine deficiency. So if someone's got visual problems, hypertension, problems with endurance, post-recovery workout, depression, anxiety can be signs of taurine deficiency, weight gain, hypothyroidism can have a bit of a link, there, and then obviously kidney disease. But interestingly, the causes, and tell me if I don't want to take your thunder with this, Jess, but one of the things I look at, and you're asking when I look at it, one of the things that we know will cause or contribute to low plasma levels of taurine are long-term vegetarian vegan diets, which of course are something that we often see in our CKD patients because they might be vegetarian. Diabetes, and it's a bit of a loop, will also cause low levels of taurine. Cancer does it as well, liver disease, heart disease, kidney disease, low levels of cysteine and methionine, and an enzyme called cysteine sulfonic decarbolase, deficiencies of vitamin A, zinc, and P5P, which is active B6. And then if you're taking excessive foods with MSG in it, chronic candida infections and general aging will all cause taurine deficiency. So I'd be looking at that. I might be running an organic acid test, an amino acid test. In those big Nutristat tests that I do, I can actually check levels of taurine. So yeah, I might be taking that into consideration. I might be going, this person, it's very diabetic driven. They don't have PKD. Taurine seems like a no-brainer for me. They might have a, normal blood pressure, but high-end normal. Maybe their systolic slightly up, the diastolic's okay. So those kind of patient presentations, and especially if they've been vegetarian or plant-based, I might be thinking taurine for patients like that. But again, it'd come back, I'm sure you do exactly the same. It comes back to that very practitioner discretion about what it looks like in a total picture, which is why it's so important to work with a practitioner in these things.
Well, and I also think with any of these amino acids, so often we want to think about supplements or medical foods as like a treatment for symptom, but you don't want to think about it that way necessarily. So if I'm going to use taurine, I would probably be thinking about it first as like, if I'm going to put in this amino acid to replenish stores, which amino acids are stored in tissue, so sometimes you would need to replenish it. When would I stop taking it? And what would I do to make sure we have enough in the diet? And one thing that I've done with some patients, if they've been like very, very, very strictly vegan for a long time, or vegetarian, or especially people that are following very low protein diets or low protein diets, is sometimes I'll do like a protein replenishment day. So we kind of
Yeah.
relax it one day in the week. I find that's really helpful. We'll add in some animal proteins on occasion, balanced with vegetable.
Mhm.
And for some people, that works so amazing because I think they get some of these little bumps of the amino acids in like taurine that are really, really important. And like, granted, like it's rich in fish and meat. You don't have to eat fish and meat to have taurine, but if all of your amino acids are low, so you don't even have enough cysteine in your system, then you can't create taurine. So sometimes you just need to have a little bit of an extra amino acid or keto amino acid if you want to keep the nitrogen lower, if you have a much later stage kidney disease, and that could be very helpful too.
Yeah, I agree. Yeah, I mean, it's such a nuanced thing where, like you said, we're looking for the one thing that's going to cure us, but often as practitioners, we look for the thing that's going to give us the biggest ROI. And so you need to look at the clinical picture of what and again, like you say, it might be short term. So we might go taurine is going to give us a good ROI because return on investment, because it's, antihypertensive and it's going to maybe really prevent those end stage blood sugar dysfunctional sort of pictures. This patient doesn't have PKD, so I'm not so worried about that. And they've been vegetarian, vegan for a long time. Yes, we'll put it in. We might even put it in on the higher end of the dose, or someone where they've been eating a little bit of animal protein. Maybe they're a little bit diabetic, but their blood pressure's okay. I might use a lower end dose and I use it in amongst other bits and pieces. So it's hard to know, but I do think out of all the amino acids, taurine's probably one of the ones. I'd be interested to see what you think, but I know when I looked at it, and this was a couple of years ago when I looked at taurine when I was formulating the alkalizing formulas, was taurine out of all the amino acids, probably second to, and followed by cysteine after it, probably had the most literature around it when it came to its role in CKD.
Yeah. Yeah, I think, well, because if we've gone through all of them, like sometimes I can't even find any studies of like, are these like really like minuscule? But taurine was like study after study after study. So I do think that there is a lot that this can be like that you can utilize taurine for, and it could be really helpful.
Yeah. What else do we need to say about it? Do you want to talk about, I mean, the other one that has got quite a bit of research in it is taurine in the liver for non-alcoholic fatty liver syndrome, which we do see quite a bit of that in CKD because of this whole metabolic shift that seems to go around with kidney disease. I mean, I'm beginning more and more to think that kidney disease is a long-term side effect of metabolic dysfunction. Because of what happens as damage in the proximal tubules. Is that something that's a new theory I'm coming up with?
I think what we'll see is that there's a lot of parts of kidney disease that are on that avenue
Yeah.
because we're seeing even like for some people low carb diets are working pretty
Yeah.
well. And so now we're gonna have so you start getting this conversation of like vegan, high carb, lower carb diets, like which one is the best for kidneys? And ultimately what I've seen in practice, because we do all of those in our practice, right? We do vegan diets, we do ketogenic diets, we do low carb diets, we do all sorts. Um, we just do personalized diets. But we
Yes.
use all those tools. And I have found for some people, like a ketogenic or low carb diet, it just works so good for their kidney function. And other people, it kind of works like, oh, like
Mm,
not great, but they like super thrive on a very plant-based diet, or other people just start plant-based and they just do amazing.
yeah, I've seen
And
that too.
so I think over time we'll kind of learn how to refine that. And I think ultimately it's not going to be about are you like vegan and have no protein or no animal protein, or are you ketogenic and have like some meat. I think that is pretty it will feel like caveman knowledge because we'll say actually depending on what your dysfunction is, maybe it's oxidative stress. Maybe it's like significant fibrosis, and then where it is in your kidneys, I think we'll be able to better pinpoint how we use diet as a therapy to generate foundational healing, and then being able to relax it back to kind of a regular, healthier Mediterranean type approach.
Yeah, I think you're right. And yeah, that was back to my thing about non-alcoholic fatty liver disease. We see a lot of that in kidney disease because, potentially of this. But, it's interesting because if you've got anything that's driving non-alcoholic fatty liver disease, that whole cycle can, with oxidative stress and all the stuff that happens with that, and metabolic dysfunction around being able to properly utilise glucose, you potentially increase your risk of kidney disease. So that was, taurine's been found to be very beneficial in helping the health of the liver. So if you've got any cross-pollination between potentially liver or, like if someone's not detoxing properly, or you think any of those things are playing a role across that, or you seeing, that central obesity kind of thing and kidney disease, that might be another indicator that taurine might be really good to mix in with that, the whole diet. And then, to your point, those Mediterranean diets, which are my favourite diets, if I'm just doing longevity, it's a Mediterranean diet. Generally, depending off genetics, but 9 times out of 10, that's where it will point to. I like to try and, like you say, work people back to that being their baseline diet once you fix everything else. So, it's interesting to see where we'll end up in the next 5 or 6 years with dietary interventions into kidney disease.
It's always changing and improving, and that, to me, is what's exciting.
I agree.
I do think we can get more and more precision, and nutrition, no matter what else you do, supplements, peptides, and anything, right? Exercise, whatever, drugs, whatever you're using for your therapy, nutrition is still like this foundational piece that you really, when you get it right, everything else is better. And that's really the key.
Yeah, and we were saying this before we hit record, we were talking about some of the new peptides coming down the line that look like they're going to be very effective for kidney disease. But, I made the point to you that it doesn't, what we know is that things like peptides will just upregulate or downregulate biological pathways inside the body. But, we were talking, if you've got a faulty biological pathway and you're going up and down regulate it, potentially some peptides used incorrectly at the wrong time may cause more harm than good, because you have to your point, have your foundations right, which at the end of the day comes back to all the basic things. I always say to my biohacking team, you can't out biohack good nutrition, a proper diet that's suited for you, staying hydrated, getting good sleep, exercising, and getting enough sun and healthy sun exposure. Like, you can't out biohack any of that stuff with peptides or anything like that. There is no shortcut to any of that. And your cat agrees with you.
I know. Yeah, she came in right at the end. She had to make her own showing. I agree with you. The cat agrees with you. Yeah.
Right. So we're all on the same page. As long as she doesn't put a big one from the camera.
Yeah, none of us are exempted from improving our health habits, but that is a cool quest to have. And I love that quest of, like, every day, what can I do to just treat my body better? And, and it doesn't matter who we are. We are all on that quest.
Yeah, I totally agree. Is there anything else you want to add about taurine? We've talked about dose. I will say, I've got this in my notes, I don't know if you saw this, if we're looking at drug interactions, theoretically, taurine might reduce the excretion and increase plasma levels of lithium, just as an FYI. And also theoretically, it can increase the risk of hypotension if you're taking antihypertensives. So I don't tell people not to take it if they're on blood pressure medication, because I'd rather them reduce the blood pressure medication potentially, but you just need to monitor your blood pressure and, maybe adjust the dose of the taurine if you find your blood pressure gets too low. That one's quite theoretical. So, and lithium's a bit theoretical as well. They weren't definitively don't take them, but if you've got a bipolar condition that's not under control and you're swinging a lot between mania and depression, probably taurine isn't something I'd go experimenting with if it were me.
Yeah, I agree. I'm glad that you did that shout out, because these amino acids can be really potent, especially ones like taurine that are cell regulators.
Yeah, and people forget that because they just think, oh, they're amino acids. But no, to your point, they can be, especially when used in higher end doses, they are very, very, they have potent mechanisms inside the body. So yeah, they can definitely move things around.
Awesome.
Cool.
I don't have anything else to add. No, I thought these are like the key pieces. There's probably more we could talk about, but on like a surface level, these I think are really key pieces.
Perfect. All right. Well, if you want to know more about Jessianna and her team, I'll put the web link in below, but they're kidneynutritionalinstitute.org. Jess, you've got an intake of, is it the Renew? When's that coming up? Do you want to make a shout out for that?
Yeah, that will be that's good. So our group program for polycystic kidney disease, we run that twice a year, February and September. So people start enrolling now. So this is done in November, but anywhere between like November and January, people start enrolling. We do a bonus one-on-one visit with our dietitian if people enroll early because it helps us kind of get them started on key fundamentals. So it's a program, polycystic kidney disease, learning a kidney-safe ketogenic approach, highly personalized, although we do group classes. You meet with your dietitian 3 times. It's an amazing program. We're really, really proud of it. We've ran it for almost 5 years now. And we have just seen a lot of awesome results, learned a lot. We're still learning all the time. But that's definitely something to check out. Whenever you're watching this podcast, you can go to our website for that group program, which is Rise, like you rise up, right? RisePKD.org is
I'll put the link in below.
yeah,
Yeah.
and that's our one just for PKD.
Oh, I highly recommend that. Keep going.
Yeah, and then we'll be doing a plant-based one next year that we'll let you know more about later.
Oh, excellent. Okay, you'll have to remind me when we do a shout out for that one. So yeah, anyone listening with PKD, I concur that Jessianna and her team do amazing stuff with that. And even if you just want to work with her or Lindsay or anyone else from Renal Nutrition, kidneynutritional.org, I'll put in the link below. They do telehealth right around the country in the USA. They can work with people all around the world because of the amazing technology advances of using things like telehealth. So I'll put all of that in there, and then I'll put all the websites so you can go ahead and check the team out. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Facebook. We post hopefully useful information like this every day. Same with Instagram. And what are we now? So we're November. By the time this comes out, it'll be past the cyber sale, so I won't say anything about that. So yeah, and Jess, what amino acids next? I think we've nearly made our way through the big ones. Do you know what one you had up your sleeve for the next one?
What is it? Oh. Did we do leucine already? I feel like.
Oh, I don't know. I don't think we have.
I think it was. No, we kind of did it with branched chain amino acids.
Oh, we did. We did a branched chain amino acid as a separate thing. You are correct.
I have to look and see because I don't know.
Okay. I don't know either.
It would be good. If not, we'll change topics.
Okay.
Not for sure.
If anyone wants us to speak about particular topics, put in the comments below, or if there's a certain amino acid, also put it in the comments below. Jessianna, thank you as always for your knowledge, your wisdom, and sharing your time with us. Thank you for being part of our community. We appreciate you all. We look forward to seeing you next time. Bye.
Okay, that's good. Bye-bye.